Hi, my name is Annie Marsh, and I am a family nurse practitioner. I'm looking for my first position as a family nurse practitioner, but I have extensive research in the RN role. I have made a video already going over a couple of the common interview questions done in a first-time interview, and I'd like to do a follow-up to that and ask some more patient-based scenarios and some other questions. So I've got 3 questions I'll be answering today, and these questions came from Indeed. The first is, what is the most difficult aspect of being a nurse practitioner? So the nurse practitioner role is full of challenges, and keeping up on the new body of literature and clinical practice guidelines is one of the most difficult aspects of being an NP. I take several times a week to read scholarly sources and upkeep my favorites bar in my Internet Explorer or Chrome. Then I also keep my phone up to date with good scholarly apps for quick lookup. Some of my most used web/app sources are CHOP, Up to Date, and the NPR Daily Dose. I also listen to conferences and CME podcasts weekly while I drive or work out. My absolute favorite is the Curbsiders. It's the Curbsiders Internal Medicine podcast, but I also like Sawbones, Primary Care Medicine, MCRIT, Child Repair Guide, American Family Physician, and the Hippo Education series. All right, on to the next question. What do you do when a patient requests unnecessary antibiotics? This is a common scenario I see in clinic with upper respiratory infections. I'm sure all providers do today. So balancing patient expectations, requests, and patient satisfaction ratings with evidence-based medicine is another one of the most difficult aspects of being an NP. Using effective listening techniques and validating that the patient does not feel well can be helpful. Sometimes I emphasize how terrible viruses feel and how terrible it is that we don't have any good medications like antibiotics to treat them. This can also help the patient feel a little bit valid and like I understand their frustration. I review all the supportive care measures like fluids, rest, honey, tea, over-the-counter medications, and other things that can help them either get better sooner or feel a little bit better. At the end, I educate about the differences between viruses and bacteria, the time frame of how long upper respiratory infections generally last, and then I also let them know what to do if they get a secondary bacterial infection. What I like about this piece is that the patient then knows that I'm willing to use antibiotics when indicated, and that they can come back and see me. In a way, this helps them know that I'm not upset with them, maintains a therapeutic relationship, gives them all the information they need. Sometimes though, there are patients who don't find that enough, and if I think the patient's educated enough to understand, and if they're receptive, I'll explain the adverse effects that can happen to them when they take antibiotics, such as diarrhea, and then some superficial facts about antibiotic resistance, so they understand what a public health issue this is, and that I'm not choosing to do this to deny them or to be unkind, but I'm trying to keep the good of the good of the entire society in mind with this decision. Next question. What would you do if a patient is not responding positively to pain medication and requests more than is allowable? I've encountered this situation many times, both in my RN and NP role. As an RN at a surgical center, I had to assess vital signs and signs of pain to report to the surgeon or anesthesiologist when pain wasn't controlled. In the surgical setting, pain was often genuine and acute, but sometimes the patient's respirations would not support additional narcotic, so I'd request something like Toradol. I would also use complementary pain relief methods such as massage, distraction, ice, elevation, smells. In my surgical center, we primarily used alcohol swabs, or we did a little study where we used some other soothing essential oils as part of a study, and that had some benefit. Now, in my NP role, Oh, actually, there's one more thing about the RN roll I wanted to mention. On a couple of occasions, something was wrong, and that was why the pain was higher than was expected. So I'd need to reach out to the anesthesiologist. For example, maybe the block didn't take and they need to do another one, or the bleeding was more than expected and I needed to contact the surgeon. Rarely they'd need to take them back in, but those were things that I needed to keep my eye out for and address. Now, in the NP role, my experience with patients requesting additional pain medication has generally been surrounding chronic pain or addiction, so I had to take great care. I would reassure patients and carefully explain that I administered the highest allowable or safe dosage. Then I would go over all the complementary methods I used above, and I'd do things that were more specific to the patient's situation. For example, if the patient had fibromyalgia or chronic mild low back pain, I could recommend low impact exercise. That's been shown to help with fibromyalgia, and a lot of people with back pain will just rest. They don't move, and they believe that is what they need to do to protect their back, but really motion is lotion, and keeping the body moving is very helpful. So I'd make sure that I would refer to physical therapy, pain management, or orthopedics when warranted. And really the most important thing I think to communicate in an interview is that I make sure I listen to the patient's concerns, I educate them about safety and what interventions are suggested by evidence, and do my best to make them feel comfortable and address each concern they bring up. Unfortunately, we can't always do that. There aren't always great answers for pain. And that's where caring and letting the patient know that you truly do care and that you want to do everything you can, but getting pain to a zero isn't going to be possible. Just trying to get it as manageable as you can should be the goal. So that is all I have prepared for today. There were a couple of other questions that Indeed recommended I answer, and I didn't have time to prepare for those. And I've actually got an interview tomorrow, so want to make sure I do some preparation for that. So I will prepare another video at another time. I'm going to include the link to the first video. I plan to post this on LinkedIn and YouTube. The first video I just posted on YouTube and appears to not be compatible with LinkedIn. So I'll make sure you have access to both, because the first interview was the more general questions that are pertinent to getting to know me. So I hope this helps any recruiters, managers, anyone who might be interested in employing me. I have got a couple of comments from people who are preparing for interviews themselves and said this was helpful. So if you're in that group, I hope this helps you a little bit too. And even though you're not my intended audience, I sympathize a lot since that's the boat I'm in. Anyway, I hope this is helpful. Thank you.